Hi everyone. Today I'm going to be talking about a medication called amphetamine sulfate, also known as Evekeo. This medication is the sulfate salt form of amphetamines. Amphetamines belong to a class of medication known as stimulants. Stimulants regulate the neurotransmitters dopamine and norepinephrine in your brain. So Evekeo is used for the treatment of ADHD, which is a very common neurodevelopmental disorder seen in children and some adults. This helps by increasing their attention and decreasing their impulsivity. It can be used for the treatment of narcolepsy, helping them stay awake. It can be used as a short-term add-on therapy for obesity. One unique feature of Evekeo is the combination of 50% dextroamphetamine and 50% levoamphetamine compared to other stimulants. This medication can be given to children ages 3 and older. For children ages 3 to 5, 2.5 milligrams is the starting dose. This is increased by 2.5 milligrams daily on a weekly interval until the optimal response is obtained. Children ages 6 and older are started at 5 milligrams, and this can be increased by 5 milligrams daily for weekly intervals until the optimal response is obtained. It is uncommon to exceed 40 milligrams in a day. This medication can be given once or twice a day. It needs to be given upon awakening, and it can be given 4 to 6 hours apart. You want to prevent giving it too close to bedtime, as a common side effect of the medication is insomnia. Also, headache, tachycardia, dry mouth, nausea, vomiting, diarrhea, abdominal pain, some changes in mood such as agitation, nervousness, anxiety, and there are some more severe side effects that include heart attack, stroke, sudden death. Slow growth is a unique side effect. You want to really make sure you're monitoring the height and weight of your patients. Decreased appetite and weight loss is also a common side effect. There are some interactions with Evekeo. You do not want to take it within 14 days of an MAOI, as it can cause hypertensive emergency. Giving it along with St. John worts, lithium, and acids, TCAs, increases the risk for adverse effects. Giving it with SSRIs, TCAs, SRNIs can increase the risk for serotonin syndrome, which includes fever, confusion, agitation, muscle stiffness, and that would need to be treated right away. There are some contraindications. It is a pregnancy category C medication, so we do not know what kind of damage it would do to the fetus, but you do not want to give it to someone who is breastfeeding, as it can pass through the breast milk and affect the child. Giving it to someone with a history of seizures increases their risk, because Evekeo decreases the seizure threshold. Any kind of history of cardiac disease, hypertension, hyperthyroidism, advanced atherosclerosis, and you want to be careful and monitor someone's history for abuse, as Evekeo is a Schedule II medication, so it has a high potential for dependence and abuse. This medication is not covered by Medicare and most insurance plans. 60 of the 10 milligram tablets can cost $471. But with the manufacturer and pharmacy coupons, the cost can be offset. I did get some research on GoodRx, and they give you an 89% discount at Meyer Pharmacy. So the cost would come from $471 to $52.92. A clinical scenario where Evekeo would be appropriate to prescribe would be an adolescent age 8, newly diagnosed with ADHD, and there was already a physical examination and review of medical history, along specifically with family history of cardiac disease or sudden death. The 8-year-old was having trouble paying attention in class, talking too much, couldn't follow simple directions. This affected his performance in school and his ability to do things at home. So this would be given. It would be started at 5 milligrams and increased when needed. Thank you.